The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day to you all. Thank you for being here and listening to what I have to say about TMD Demystified. My name is Tony Urbanek. Today's topic is entitled How to Think. How to Think. We could also entitle this episode Ask Your Doctor and TMD, because the problem is both doctors and patients are confused about this topic that we call TMD, that they want to call TMJ. So confused they even named it wrong, and everybody still calls it TMJ, which is the name of the joint. We've talked about that so many times. The confusion about this problem, TMD, is amazing to me once I began doing the investigation myself and put away all the biases that I had or that I could find in my own space and in others' space, the biases about this problem TMD, and investigated it all the way back to the beginning of where it was first, quote, discovered. Of course, it's always been there. You know, a disease doesn't come out of nowhere. It isn't created by a thought process. It exists, whether it be bacterial disease. There are some diseases that are made worse. Certainly a great example comes to mind is lung disease and cancer, lung cancer, with the addition of tobacco to our environment and use. Great example. But lung disease has always been there of one variety or another. There are certain environmental things that make it worse, make diseases worse. But TMD, temporomandibular joint disorder, single disorder, not multiple disorders, is a problem because the patients don't know how or what to ask their doctor about the problem. They're totally reliant on the doctor and his supposed knowledge of this problem and his ability to diagnose and ferret out the correct diagnosis based on the very disparate symptoms that the patients sometimes present with. So again, it's another way to describe the tremendous conundrum that is associated with TMD, to the point where the dentists, who are supposed to know how to treat it and don't, and they admit they don't know how to treat it, but they're supposed to know how to treat it, when they hear, for the most part, when most of the dentists who are supposed to treat it hear a patient who has the symptoms or needs help or wants treatment or is approached by someone who wants to talk about TMD in any way, they put their fingers in their ear and they say, I don't want to know, because they think it's a big black hole that has no solution. That's the consensus. Now, if that's the consensus of present time, 2025, it stands to reason that there's been a problem with how to think a problem through, because if there is a problem, there's always a solution. You're either asking the wrong question or you're asking the wrong person or source. But if you have the right question, if you know how to ask the right question, and you have the correct source or person, just call it the source, then you can always find a solution to a problem. I stand by that. I was asked to do a paper on that one time after an interview from another podcaster. However, it boils down to how to think a problem through, how to think. And so let's just say that this episode is going to have a co-title, basically Ask Your Doctor in TMD, how a patient can think to ask a doctor about the problem, and coincidentally, how the doctor needs to think about the problem to come up with a solution to give to the patient. Now, I've already succeeded in this process, and frankly, it's known as the Urbanek device and protocol when it comes to TMD. And please, if you want to get into the heart of that, there are multiple episodes on this particular platform, and you can look up many of the titles that addresses exactly what the device and protocol is, how it works, what I found about it, the basic issues with TMD, and specifically how chronic inflammation in the temporomandibular joint drives all the symptoms. It's one disorder. Disorder is chronic inflammation in the joint, which creates all the disparate symptoms. But we're back to how do you think a problem through as it applies to TMD. Now, this is very, very, very substantial and valuable information that I'm going to share with you. And so if you're interested in learning how to think a problem through, I hope that you settle down and think about each of the comments and statements that I'm about to make. I spent a lot of time learning for myself how to think a problem through. And just to refresh on my credentials, I have a bachelor's degree, a dental degree, a medical degree, master's degree in cell biology and anatomy. I did an MBA, and I was a fellow with NIH for 2 years on the topic of facial growth and development, and proved that you could make animal models with facial defects using intrauterine fetal surgery and zapping them with a laser. That doesn't mean anything to anybody other than I've had a lot of opportunity how to think a problem through, how to come up with a solution of many kinds, and 50 years as a practicing private practice oral and maxillofacial surgeon, and had the opportunity to think hundreds and hundreds of unique problems through in the operating room. It was a lot of fun, actually. So I have something to say about how to think. Now, first of all, I've already talked in prior episodes on Dentaltown on this platform about inductive and deductive reasoning. There are two generalities on how to think a problem through. Deductive reasoning is the one that most people use. It is the one that is most often, by far, 99% of science is based on deductive reasoning, and probably only 1% is inductive reasoning. They're both valid ways to reason a problem through. They are unique in their own right, but they can be used together, not simultaneously together, but together as, number one, deductive reasoning, number two, inductive reasoning. And I'll explain that in a minute, exactly how that applies to TMD and how I came up with the solution for a real solution, non-surgical, valuable solution for TMD. So deductive reasoning is kind of like Sherlock Holmes. You see a issue, you see a problem that needs to be, who killed the person in the study. And then Sherlock starts looking for pieces of data, just looking at data points, and trying to determine off of multiple data points who did the crime. That's deductive reasoning, but it also is a very, very valuable scientific method. But the data points get to be huge, huge, not 10 or 15 or 50 data points, thousands and thousands and hundreds of thousands of data points, pieces of data, that you can pick and choose these data points, these pieces of data, to try to explain what is going on, what happened, what did you observe? And then out of thousands and hundreds and thousands and millions of pieces of data, you choose the data points you want to pick out that explain what you just observed. That's deductive reasoning. Inductive reasoning is a lot less common, but can be extremely valuable, which is exactly what happened when I, quote, discovered all of the data actually was in the literature. All the data was in the literature. So I could have gone out and cherry-picked those pieces of data to explain what I had observed, but I didn't have to because I used inductive reasoning to get me there. So to continue the train of thought in thinking, how to think a problem through to come up with a solution or the truth. A solution is nothing more than the truth. Inductive reasoning was generated by, instead of me sitting down and telling the patient what kind of surgery that I was going to perform to handle their disparate symptoms that they came in with and shared with me, I decided I was going to quit doing surgery and started to actually go back to the source. The source, remember, if you don't have an answer, you're either asking the wrong question or you're asking the wrong source. So the source of a medical problem is the patient themselves. So I had plenty of those who actually wanted surgery. I was the TMJ surgeon in Nashville with 2,000 temporomandibular joint cases under my belt at the time. But I would bring these ladies in. It's 90% females, 10% males, and so it's mostly females. And I bring these ladies in, and instead of telling them what kind of surgery I thought was the right thing to do, I said, tell me all about it. I want to know what you think about it. I want to know what makes it better, what makes it worse. What does your husband think about it? Does the dog bark when it hurts? What phase of the moon is it? I'll listen to whatever you can tell me about this problem. I want to know everything you know. And out of 24 women, half of them, roughly half of them, 12 of them said, if I put my finger, a pencil eraser, my tongue, a piece of cloth between my front teeth and gently bite down, it feels better. So I made a device that did just exactly that, something that they could put between their front teeth, but they could keep between their front teeth and talk with between their front teeth and would be comfortable between their front teeth. You just can't eat with it, so you got to take it out to eat. And that was the beginning of the solution, because after I did the first one and gave it to the first lady and said, keep it in your mouth for 3 weeks, come back in 3 weeks, use it 24/7. Except when you eat. And when I walked in the room 3 weeks later, she looked up at me and she said, thank you, doc. My pain is gone. And she had 20 years of headache, earache, jaw pain. Now, you've heard me say this story before multiple times, but the point is, this is describing how to think, okay? You've heard the story before. I don't mean to repeat myself. Apologize. But we're talking about how to think a problem through. So, in this case, I used inductive reasoning. The solution was actually given to me. I was given the key. I was pointed in the right direction. And I tried that out inductively. And then after I found out that I had a patient that it was successful with, I did 20 or 30 more, and also found out that rapidly that disparate symptoms began to decrease in each and every one of those follow-up patients, at which point I had 25 or 30 patients under my belt, and I did not know how it worked. which then I went back to deductive reasoning. And I went back to the books and I started looking at data points. I started looking at data having to do with what I knew was something that I observed when you separate the back teeth and only have the front teeth touch, and separate the back teeth long enough according to a protocol, which is 24/7 for 2 months, nighttime only or sleep time only the rest of your life, but that's the protocols. It's a device, tool, and protocol. The results were through the roof, but how did it work? I did not know at that time, but then I used deductive reasoning. First, I used inductive reasoning, asking the right source, the right question. Then I went into deductive reasoning and started to cherry pick the pieces of data, the data that I thought would apply, and then figured out how a device used with this protocol had such tremendously successful results. All right, but that is one way to think. Now, that is what I use. Now, I am always listening to others. I always try to learn. I love to teach, but as I teach, I always love to learn. And so recently, I was on the internet and I was following one of the people that I think a lot of, who is attempting to solve a problem. You may recognize it, and I want to give credit to this gentleman, this man, where it is due. His name is Richard Dolan, and you may recognize the name, Richard Dolan. I'm not going to go into his bio, but he is very well known, looking to solve a specific problem in our culture right now. And I want to give him credit for his take on how to think, which is a extrapolation of what I just talked about, is about inductive and deductive reasoning, but a very practical way of thinking about a problem. And I want to apply that to how an individual, whether it be patient or dentist, needs to think about solving the problem of TMD for themselves, for themselves, for the doctor, or for the doctor's practice. So credit is credit due, and Richard Dolan is a journalist and investigator. You can look him up if you'd like to. And these are the 9 points he likes to use when trying to solve a problem. They're very practical points. I listened to him and I went, I need to share this with my listeners. They're very, very valuable. About when investing a problem to find the answer or find the truth. An answer is nothing more than the truth. Truth about a problem, truth about a situation, truth about a person. So here are his 9 points, and I want to, as we go through this, apply to specifically how a patient or a doctor needs to think about what they should do, what action they should take about solving the problem, either for themselves, individual, I have the problem, I'm a patient, or I'm a doctor who needs to find the right answer to this problem, called TMD. So his first point is prestige of source does not equal validity. Prestige of source. And that is specifically directed to what I call the TMD gurus, who like to use their academic prestige. It applies to university professors especially. Unfortunately, I have in the past and recently talked to many university professors who think much more of themselves than they think of using logic and good thinking principles to solve the process of TMD. And they do things that are not logical, that make no sense in trying to solve the problem of TMD. But they rely on their prestige to convince others that they're right. So point 1, via Richard Dolan, is prestige of source does not equal validity. So when you're looking at your source, don't get wrapped up with what they think is their prestige. All right, number 2 is truth emerges over time. Truth emerges over time. So it takes time when you have a real conundrum, a real confusion, when you have multiple people over a situation that have obviously not found the solution. Well, the real solution takes time to run through the different processes that need to carry on to actually find what is going on. As an example, it took me a lot of time, first of all, 36 years of doing surgery 2,000 times to the temporomandibular joint before I gave up on thinking that surgery was the ultimate solution for the temporomandibular joint problem. Again, we had some successes. In fact, 2/3 of my cases I would consider successes. Patients did extremely well. A third of them did not. They would be back within a week, within a year. Within a year or two, a third of the patients would be back within a year or two with the same symptoms they came in with originally, which generated my decision not to do any more TMJ surgery and look for the answer by using a thoughtful thinking process, which we're going through today. So it takes time. It took me time. It's, first of all, 36 years to get to the point where I went surgery is not going to be the ultimate answer on this. And then I did the research that I just discussed, and we went to how you can do a non-surgical process, device and protocol. And that began 14 years ago. So it's been a 50-year journey for me in particular. Truth emerges over time. Number 3, track record matters. And the track record really can be defined in several different ways, but the track record of a person who is promoting a solution the track record of the person who has he or she or the organization, if you will, had a prior track record to successfully solve other problems. Are they successful in their track record? Very important. And let me add right now, it is a very old adage and euphemism. There are those that can do and those that teach. And I'll leave that to your own discretion, but it is a true statement. And I apply that to statement number 1. So track record does matter. It isn't the ultimate authority. In fact, how to think actually includes all 9 of these principles. These are principles of how to think. Number 4, testimony is evidence, but not proof. So testimony is important. And if you have multiple testimonies, they can be put into a paper, lumped together, or you can just put them in a serial fashion, 10 testimonies, 100 testimonies, 100,000 testimonies. They are evidence and they are important, but they are not proof. So you certainly can and should look at testimonies from patients, in this case, TMD patients who did that procedure or surgery or device and what their testimony is. In our case, we have 5,000 successful cases and hundreds and hundreds and hundreds. I would imagine probably 1,000 positive testimonies, but that's not the point. It's just one point about thinking. It is not proof in itself, which brings me to the concept of statistics. Now, statistics are very important also. You can look at it and see whether a solution holds water by looking at prior testimonies from people who were treated for TMD in a certain way. But there are also statistical studies. But statistics alone are not a proof. It is a higher level, I think, of proof than testimonies. But I think they work together, and you have to have a certain amount of statistics, But actually, another adage you've heard, I'm sure, for sure, is that there are lies, damn lies, and statistics. And so statistics can be manipulated. And hopefully all of you know that you can statistically manipulate things to favor your position. But they are important, they are valid, but they're not the end all and be all. I would think that statistics plus the evidence of testimony would be very well considered and important. So in our case, with our device and protocol, we have hundreds and hundreds, thousands of testimonies, but also a university independent study with statistical, quote, proof. And then you can look at the statistics, and anyone who would like that statistical study, independent university study done at Tennessee State University, based on, at that time, 3,000 patients. I gave the university 3,000 names, 3,000 patients. These were patients who were treated in our office. And please do the study, a retrospective study on 3,000 patients. What was their success rate using the Urbanek device and protocol on their symptoms of headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, upper back and shoulder pain, and various kinds of locking. Number 5, beware of the narrative velocity. In thinking a problem through, if you see someone approach you, or there is something on the internet or that you read that has a great velocity to it. In other words, it comes on you rapidly and fast, velocity, rapid and fast. Be suspicious, because a rapid acceptance of the explanation is dangerous. A good example of this that everyone now at this date and time, which happens to be September the 9th, 9/9/2025, is AI. I did not even hear of AI until roughly a year ago, and now it is all over the place. Everyone is promoting AI rapidly, absolutely rapidly. Everything is related to AI. AI is related to everything else, and people are, there are two sides to the issue. It has not been solved yet. The truth has not come out yet, but it is definitely an example of beware of the narrative velocity, because there is a lot to know and a lot to study and a lot of experience and a lot of testimony and statistics that need to come out about how AI fits in any kind of topic, including TMD. Be suspicious, but AI is never going to replace the human ability to think. We'll talk about that in just a moment. We'll finish this up. Beware of the narrative philosophy. It's very dangerous, and AI is a really good example of that. Number 6, separate mystery from the hype. Lots of hype makes it suspicious. If someone is hyping something, be very suspicious of that. The best example regarding TMD that I can think of is Botox. Botox has been hyped. Hyped why? Hyped highly because it's great for wrinkles, but the Botox, or the generic to be used, but everybody calls it Botox, but the generic botulinum toxin A, and there are several different makers of botulinum toxin A, but Botox is actually the name of the generic nowadays. It's a scam, because we've proven that if you put saline or Botox into a muscle, it does the exact same thing. I've talked about that in a study, good study in the Journal of the the Association of Maxillofacial Surgeons. So a good example of separate the mystery from the hype is the hype of Botox. But everybody wants to use Botox because they think they can make a lot of money at it. That's the truth. That is the fact. That's why the doctors out there, they've been hyped, and they have the Botox people have a lot of money to spend on promotions, and it's highly piped, and you should be very suspicious in your thinking process. Number 7, source of hierarchy is not truth hierarchy. So again, this leads back toward prestige, but the hierarchy of the source is not the hierarchy of truth. Number 8, and this is very, very important. I think out of the 9 things here, that this is, to me, and I will promote it as the most important. Let evidence shape the theory, not the reverse. Let the evidence shape the theory, not the reverse. So in this case, when I discovered that if you put your tongue, a pencil eraser between your front teeth, it feels better, that was evidence, not theory. Although then I had to, once I figured out how well that worked, I had to theorize how it worked. But the evidence of it worked on 30 ladies and got similar results, positive similar results, shaped the theory. And the theory then turned into exactly what I described as chronic inflammation drives all the symptoms. And now that can be proven by an academic study, statistical study, and multiple hundreds, thousands of testimonies from patients. Again, thinking the problem through. How do you think a problem through as it applies to TMD? And you can use this. This is valuable information. Use this in solving any problem in your life, any problem in your vicinity, if you think it through. Item number 9 is don't let AI or what you see on the computer keep you from thinking. Again, I touched on that, but it is a separate item. Don't let AI or what you see on the computer keep you from thinking, because nothing is going to replace the human ingenuity to think. I will only quote another highly esteemed person, researcher, individual from many years ago, and ran into this information in my vast training in philosophy and theology. Rene Descartes, cogito ergo sum. Cogito ergo sum. I think, therefore I am. I'm going to let you ponder that one. I'm just going to leave it there. I'm not going to explain that at all. With that said, I think I've gone on a little too long on this episode. I enjoyed presenting it to you. I hope it's meaningful. I hope you can use it for temporomandibular joint purposes, TMD purposes, both patient and doctor. But I hope it is some valuable information that you can apply to your life, truly. Until the next time that you're here, listening to TMD Demystified, I am Tony Urbanek.